Hello everyone. My name is Connie, and today I'm going to be doing my presentation on historical healthcare markers timeline. If you'll excuse me, I'll be talking a little low because everyone in the house is asleep. Okay, first we're going to talk about why it is important to know about the healthcare delivery systems. We're going to start off with a few statistics. First of all, everybody is going to need healthcare at some point in their lives. It could be for something small, or it could be for something devastating. I know there's lots of people that I've talked to in my organization that said that they never thought they were going to have to go to a doctor, or they never saw a doctor until they actually found out they had cancer. So you might not think you're going to end up having need of any major health care or have any major healthcare issues, but most people do at some point in their lives. And it's also so important as consumers, because we're the ones that's going to have to pay for it, to know how it works and how the delivery system works. The U.S. spent $3.3 trillion dollars, or $10,328 per person in healthcare expenditures in 2017. And I'm sure that that number has went up in the last few years. In 2021, 8.3% of people, or 27.2 million, did not have insurance. That's a large number of people. A lot of people pay out of pocket, and most of those people are young people because they don't feel they're going to get sick. And as expensive as it is, some feel like it's just easier not to have it at all because of the cost of it. There were 130,000 million emergency department visits in 2018, and probably most of those, a lot of them, were those people that didn't think that they were going to have go and get any care, so they may not have the primary care because they don't have any insurance. 44,000 and 100,000 citizens die each year as a result of medical errors in the U.S. hospitals. That's a large number, and those started keeping track not too long ago. Actually, it was a significant amount of time ago when they actually started noticing those types of things, and certain agencies were put in place to make sure that that didn't happen. And that also makes the cost of health care go up as well. The percentage of children in the United States with no health insurance has dropped from 5% in 2019 to 4% in 2021. Seems like a small number or a percentage rate, but even 1% is better than nothing at all, because we want children to be insured so they can be taken care of properly. The U.S. is the only major country that does not offer a universal health care program, since I feel like it's quite ironic that we're one of the greatest nations in the world, as far as, we we do everything. Everybody wants to live here, but yet we can't offer universal health care to our citizens, or some type of health care program, at least one better than the one exists today. Okay, now we're going to go through a little bit of the history, how some things or markers that came about during the past has led to the healthcare system that we have today. Starting out in 1781 was the first medical society that was established, and it was the Massachusetts Medical Society, and it still exists today. It actually has 25,000 members out of the state of Massachusetts, and it actually, what the purposes that it served is to promote knowledge about surgical procedures and health care, and also to let people know about the effects of medicine. Then in 1865, the medical division of Freedmen's Bureau is established. And what was this was after the Civil War, there were institutions or makeshift hospitals established for freed slaves, and other people could go there to get clothing, food, and shelter after the Civil War. This was established by Congress in 1865. In 1981, the American Medical Association became a national organization of state and local associations. Now, this organization had started its formation earlier than this, but when it actually got recognized as a national organization was in 1901. The American Medical Association has been a strong influence for a lot of years. It started out with just 8,000 members, and in a 10 years time it increased its membership into 70,000 members of physicians. Once you see this seal of approval from the American Medical Association, they used to be, or and still is, the seal of approval, and they've got a lot of pull when it comes to legislation. In 1905, the American Association of Labor Legislation was established, and this was the AAALL, and it connected a study on the societal and economic impact of sickness. So this is where they're going to look at how much it's cost the different states, or this a country as a whole, on what it does to the economy for people to pay for health care and when people are sick. It also looked at, providing care to workers, so when they are sick, they can be compensated whenever they're out, to be able to cover their lost wages as well. In the 1920s and in the 1930s, a little more progress was made, or changes started coming a little more quickly. In the 1920s, healthcare reformers placed more of their focus on insurance coverage for medical expenses, as opposed to giving insurance to give lost wages, or to cover lost wages, because medical expenses tended to be a whole lot more that needed to be spent than replacing the actual medical wages. So even if they were able to keep the money that they lost, or was given money to cover the money they lost if someone was sick, they still ended up having to spend a whole lot of money, or people had to spend a whole lot of money on the actual care that they were given at this time. So the reformers were looking at that in regards to healthcare insurance. In the 1930s, there were major developments in healthcare. A social reform program called the New Deal. This was established by President Roosevelt. This was the first time that there was ever a critical look, or the health care of the United States was looked at critically as a whole, and what could be done to better the health of the citizens of the United States. Um, then the American Hospital Association created the Blue Cross plan in 1933 to pay for hospital costs, and this was not something that the government was, that they were not very happy about it. It was later on that it became Blue Cross and Blue Shield, and it was put in place to cover other medical costs. Doctors objected to the government involvement in healthcare, but three-quarters of Americans approved of the government helping paying with, or excuse me, paying for health care. And so American, or the Blue Cross and Blue Shield, is, most people know, is insurance that is still there and still in practice today. Last here on this, as far as progress in the 1930s, is the President Roosevelt signed into law the Social Security Act of 1935. And this would provide an insurance and welfare programs for elderly, unemployed, and disadvantaged Americans. At one time, the program was designed to just be a key financial benefit for Americans who reach retirement age, but later on, the government began collecting Social Security taxes as a provision to pay monetary benefits to persons age 65 and older based on their payroll tax contribution. So basically, if you put into Social Security, you will get it back. So those that do not, you will not receive, or you won't receive any money when it comes time for you to be eligible for Social Security. Okay, now we're going to talk about the 1940s and the 1950s. It's during this period there really wasn't a lot of reform or legislation. Well, there was legislation going on, but not anything that was significant that was going to change the healthcare system drastically, I should say. So during this time, we have a healthier population, but a lot of people are insured first. But then was starting in the 1940s, physician wages actually doubled. They saw, how important they were, and there another reason why was because they were in so high demand because it seemed to be there was a shortage of physicians as well. And as I said before, during the 1940s, the overall health of the nation had improved. People were starting to pay more close attention to their health, and people were living a little bit longer at that time than they did in the early 1900s because of there was improved access to healthcare and more focus was put on our preventative care, or it was beginning to be put there was beginning to be a focus on preventative care. um, President Truman offers a national health care program, and later on, of course, and there was more revisions made, and these all the health care plans that were presented by different presidents that didn't pass. A lot of it was still brought into the next legislation and bits and pieces of it. So most of the time, these different types of legislation were built off from a previous one that may not have passed. But um, President Truman's his healthcare program was proposing a single system that would conclude all of the American society. So basically, he was looking for something that was similar to universal health care. But the program was similar to that of Germany's, um, and a lot of people considered it to be. It wasn't very popular because they thought it was considered to be communist because it was taken from the format or how the Germans did their healthcare. So we weren't wanting to do anything like the Germans or um, utilize something that they were utilizing because of the position and of what was going on in Germany at that time. Then in the 1950s, um, there was a significant development. It wasn't actually in the healthcare reform, but the polio vaccine was developed, and eventually the World Health Organization would consider to be um, a pandemic or an epidemic, or it would be something that would be completely eradicated. Um, and later on, they would make that announcement. At this time, when the vaccine was developed, and it was a lot of kids that it was affecting, polio was affecting. So they were some of the first to actually receive the vaccine. Um, at this time in the 1950s, there wasn't a lot of focus put on mental health, and a lot of mental health issues were overlooked, and there definitely wasn't any insurance regarding mental health conditions later on. And it took a while before insurance covered mental health conditions or anything to do with it, and that wouldn't happen later on in the 90s. So the mental health would be covered a little bit better, but at this point, there was very little assistance when it came to mental health issues. I put this one in here because this one to me is very important, and I'll elaborate later on in the presentation about the Joint Commission accreditation of hospitals, and this was established and formed in 1951, and this was important because it had to do with standardization of healthcare facilities, which is very important because people need to know that when they go to one hospital or to another, that they're receiving the same type of or seeing same type or quality care that they receive from another hospital. That just because it might be in a different neighborhood, or if they see that it's been inspected and know that this hospital is safe to go to, just like any other place is inspected, whether it be a restaurant or that, when they know that these inspections are taking place and people can feel confident they're getting the best care possible at these facilities. Okay, now to the 1960s. This was a major or significant time for legislation in healthcare reform. Uh, it's one of the most significant when it comes to health care for the elderly, and it also affected those who were poor and those who could not afford health care or met a certain income bracket, and that was the Medicare and Medicaid Act that was passed in 1965 by President Lyndon B. Johnson. There were some different types of that were very similar legislation that was previously tried to be passed earlier, before this actually took place. But this one is the one that actually made it through, and it was based off of the taxes uh, the people, are paying for it, and we still do pay for this as well. And there's definitely provisions that have been made to Medicare and Medicaid Act since this time. Things added on to Medicare. For example, Medicare Part A and Medicare Part B, depending on what you're talking about. Some has to do with a prescription coverage, and there may be more added to it later on and in the future. Medicaid is actually regulated by the states, but Medicare is actually regulated by the federal government. So that is the difference between the two, and uh, the states are allowed to add to or make provisions or do reform to their uh, laws in regards to in regards to Medicaid as well. And then also in the 1960s, due to the fear of physician shortage, they started adding programs for more training in different health care fields. Nurses became more prevalent. And they added a whole lot of more training for nurses, and they created programs for things. For example, a lot of colleges created programs for physician assistants. These were something that wasn't available at one time, and they saw the need for more people in healthcare, so it took a lot um, of load off of the pay or off the physician himself. For example, if he had a physician assistant or a nurse, all those healthcare professionals that help the providers do their job. Okay, in the 1970s, after we had the big piece of legislation that passed it in 1965, which was strictly for the elderly and for those that were in a certain income bracket and couldn't afford health care, and that would be your Medicaid. Uh, there were still those in between that did not meet those requirements or elements and are still having to deal with the rapid escalation of healthcare cost. Um, there was, I mean, healthcare advances had had constantly, or there was constant advances in healthcare during this period of time. But Americans, they still lack the basic access to care that they needed to deal with just the basic needs that they had. So with this, President Nixon in 1973 uh, introduced the Health Maintenance Organization, which is what everyone knows as the HMO. These are medical insurance groups that provide health services for a fixed annual rate. So it won't, and excuse me, our annual fee, so it won't go up. HMOs differ from ordinary health service package providers, and there's a lot of debate on whether or not HMOs, were effective. They're still around, but they're not as popular as they were whenever they first become and when they were first introduced in 1973. Um, then in the 1980s, they provided a rapid and dramatic change for the healthcare industry, um, because they wanted to shift toward being privatized and to be owned by corporations instead. So then there was more autonomy in how things could be run, and because with being attached to the government and being government ran, there was more regulation. So a lot of healthcare organizations wanted to be shifting, being privatized, or being or being corporate as well. And then during this time as well, President Reagan, he shifted payment um, for uh, for care by diagnosis, and it was not based off of the treatment. It would just depend on diagnosis. And this is another area where it's so important for us to know about our healthcare terminology, because even into insurance today, if you have the wrong diagnosis code, it will not pay for certain care that needs to be done. So providers have to be very careful on how they word what is wrong with a person. So if they miss one word or forget to say something specific about a diagnosis, that person may not have to be covered and may receive a huge bill. But when President Reagan did this, this was changed everything as far as how they billed for Medicare and Medicaid. But also, it wasn't long after that the private insurance companies realized that that was what they were going to need to do as well, that they were going to bill based off of the diagnosis instead of the treatment. Okay, the 1990s and the 2000s, or I guess I should say 2010, were big areas or big time um, for healthcare reform or things going on in healthcare. We'll get to the passage of the landmark legislation, but we can go over a few things that happened in the 1990s. First, you had the National Committee on Quality Assurance. It formed and it was put into place so it could credit managed care plans. And basically, what it was looking at is to provide, quality improvement measures and quality improvement plans, so to organizations to ensure that they were maintaining their quality and how they can maintain their quality in their organizations. In 1996, everybody has loved this day. If you're in healthcare, when the Health Insurance Portability and Accountability Act was enacted, we all know that as HIPAA. It's a word that is thrown around quite often, most especially in medical facilities or healthcare. And this was a very important piece of legislation as far as going over and making sure that patients' rights or privacy was taken care of, and people weren't giving out information that they weren't supposed to. But it basically, for the most part, was making holding people accountable for sharing information or looking at information, and just taking care of the information that they have that belongs to someone else or healthcare information. So if you violate any of the provisions that are in HIPAA, there is definitely fines to be paid, and there's people that have done it. But it's basically there to protect the patients and the confidentiality that they have, and or the confidence that their information is not going to be shared um, with anybody that it shouldn't be. Um, Later on in the 1990s, federal health care reform legislation, it fails again to pass in the U.S. Congress. And this was something that President Clinton was trying to pass through. And there was a lot of similarities in his health care reform that he was trying to take care of or trying to push through. As you will see later on in the Affordable Care Act. But he pushed diligently to try to get healthcare reform to pass through, but it didn't. Once again, he wasn't the only one that attempted to make provisions to healthcare, or only president that was before this time, or major ones. It's because it seemed like there was a lag period between 1965 and this time, that there were little changes made, but nothing that was going to just overhaul the whole um, healthcare system. And of course, we all know that, well, most people know that that happened later on. Um, then in the 2000, um, at the beginning of 2000, Breast and the Cervical Cancer Treatment and Prevention Act of 2000 became along, and this was very important to those who were of lower income. Those people who were on Medicaid at one time were not able to get care for diseases such as breast or cervical cancer. But once this act was put into play, then those people who were on Medicaid were able to go and get care for diagnosis of diseases such as breast and cervical cancer. If not, these patients probably would have, many of them would never been able to receive treatment, because cancer treatments are very expensive. So under this provision, those people who couldn't afford it, basically those were in the income to be on Medicaid and received a breast or cervical cancer diagnosis, they will be able to receive the care that they need. Also in the 2000s, we had the American Recovery and Reinvestment Act. The biggest part of this act was, or the most important element of this act, was the implementation of the electronic health record into healthcare organizations. That if there was incentives given to organizations that implemented the electronic health record and went away from the paper. And the purpose was this: so it would be easier to share information between organizations. And even though sometimes electronic health record software or implementing these systems may seem costly at first, they really do save a lot of money in the end, because there's not a duplicate. A lot of things are not duplicated. It could be whether it's test or lab test, and information is passed where providers are not doing procedures that isn't not warranted, because if they have the information available to them and it's easily accessible, there's lots of things they can save a lot of time to care for this patient and provide diagnosis. So the development of this through this act of implementing the electronic healthware and using it meaningfully, because it has to be it falls under the meaningful use concept. It has to be used meaningful. Then these organizations that do this will receive incentives to establish these EHRs in their organizations. And then at the end of the 2000s, or the beginning of, I should say, at the start of 2000, but at the end of the first, there was 2010, and one of the passage of the biggest piece of healthcare legislation happened in 2010. President Obama, he signed the legislation called the Patient Protection and Affordable Care Act, and this was put in place. There's a whole lot to this particular act, but it was just the main purpose of it was to make it easier for people to obtain insurance, make easier access. They created a website where you could go on and see what your possibilities are, what your options were for healthcare. If I remember correctly, at the time that the website was put up and when this went into place, that I believe that the site for Obamacare uh, and the Affordable Care Act, I should say, actually, what is the word I'm trying to use? It failed several times. It went down because there were so many people on it trying to get signed up. Uh, but it also penalized those who didn't get insurance. So if you didn't have any healthcare insurance throughout the year, you would have to pay a fine. And there was a lot of people that didn't agree with that. And then there were uh, some areas that were not covered. There was a lot of legislation or debate this year, or it might have been last year, over whether or not pre conditions um, before you get the should be covered. So that was a debate as well. So there are changes that have, and I'm sure there'll be more changes to this actual act in the future. But it was a significant piece of legislation and it took a lot because obviously, as you can see through the past, that there has been many attempts to some type of major overhaul of the healthcare system, but it just didn't make it through. But President Obama was able to get it through in 2010. Okay, so we're going to talk about one of the significant timeline markers. Probably not the most significant timeline marker, as we already discussed earlier. There were so many things going on between the early 1900s until today. Small pieces of legislation, large pieces of legislation, but all of these formed together, put in together, has definitely formed what the United States healthcare delivery system has today. So all of them are important in some way. So I chose the Joint Commission, which is what it's called today, because I feel like that it is very important to have some type of oversight into how healthcare organizations run and making sure they're run to standard. Um, I guess it just comes down to accountability because sometimes the people have the tendency to, uh, if no, they're are they going to do what's right if no one is looking? But most people, if they know they're being watched, is sad to say, that they will do the right thing. And so basically, that's what the Joint Commission is about. So here it says Ernest Codeman and was a medical doctor, and he proposed the end result system of a hospital standardization. So, in order to have that standardization, you have to have someone come in and make sure that everybody is on the same sheet of music. So, one organization sets the standard, and everyone follows that standard. And eventually, that standard was set by the Joint Commission. Uh, in 1951, the Joint Commission on the Accreditation of Hospitals, and they formed to improve quality of hospital care through voluntary accreditation of hospitals. Okay, so you say yes, it is at that point voluntary if you were going to inspect it, but it's at a point there was at some point where if you didn't have that joint commission, you weren't going to get funds from the government, but also it's just not a hospital you're going to want to. That was the gold seal of approval. You needed that accreditation. I guess it would be like saying, asking people to come to your restaurant even though you had not had your food and safety inspection, even though I feel like that those types of inspections are actually not voluntary. They have to be done. So, but at that point, the inspections were actually on a volunteer basis. Hospitals accredited by at that point, the Joint Commission on Hospitals accreditations. They're considered to be in compliance with most conditions established to be involved with Medicare and Medicaid programs. So, at one point, there was a piece of legislation that was put out that if a hospital was accredited by the Joint Commission, that they would go ahead and they could be involved in Medicare and Medicaid programs because most of the guidelines that the Joint Commission followed or followed was fell in line with the being in compliance with Medicare and Medicaid programs. So if they passed their inspection, then they were good to go in regards to Medicare and Medicaid as well. The Joint Commission is the nation's oldest and largest standard setting and accrediting body in healthcare. Um, that used to be when I first got into healthcare, the Joint Commission, you said the word, everybody ran around like chickens with their head cut off. Uh, I'm in the lab field, so we get inspected more often. We have so many inspections, it's insane. We get inspected by College of American Pathologists, we get inspected by the for blood banking, the FDA. So the Joint Commission wasn't very scary for us in the laboratory because we always knew that we were always, if we passed our CAP inspection, we could pass our the Joint Commission inspection because most of the times they were only looking at our patient care areas, which was our phlebotomy areas. So, but Joint Commission is something that everybody in the hospital is responsible for. It doesn't even matter who you are, whether it be housekeeping and whether it be housekeeping all the way up to the people who are the CEO of the hospital or the organization. When Joint Commission comes along, there are certain questions that they ask you, and everybody should know them. It doesn't matter what job you have, and it could be, what would you do in case of a fire, or for that as an example. But just because you're not actually providing care to patients doesn't mean that you're not going to get asked a question by the Joint Commission. So they're just trying to make sure that everybody, that's all a part of teamwork and knowing, and that nobody's being left out, and everybody's being provided information that they are supposed to. Okay, listed here is just a few more of the things that the Joint Commission has done since their establishment. Uh, the name changed. At one point, they were actually called JACO, and that's when when I first heard of it, that was what Colin and everyone ran around saying JACO's coming, and that was when they were called the Joint Commission on Accreditations of Healthcare Organizations. Excuse me. At one point, they were only uh, inspecting hospitals, but then they broadened their inspections to all different kinds of organizations. Uh, as they've went throughout their years, they have become like the number one organization for accreditations for all different types of practices, whether it be psychiatrists or um, psychiatric care, memory care facilities. They are they are pretty. They're at the top of the ladder for accreditations. Are people are the people that you want to come in and inspect your organization, because once you get their seal of approval, then you're square. People know that you're squared away. The Joint Commission also established the Sentinel event policy. You're going through, and when you have a safety issue or things happen, they're rated, and they've come up with that as a way for hospitals or organizations to be able to rate safety issues, whether um, how they affect the patient, how they affect the organization, and there's a established scale, and the significance of the event that happen, and they rate them that way. So that rating system and the Sentinel event policy was created by the Joint Commission. Patient safety goals were also invented or created in 2002 by those. If you've been in any type of healthcare organization, you have probably heard of patient safety goals they establish different ones each year usually, and then they usually always have a standard of 1 to 2 or 2 to 3 that never change. Usually that's your patient identifiers, such as your name, birth date, making sure that you identify patients correctly, along with a couple more. But those change from year to year, and that's something you definitely have to know whenever they come for inspections. In 2006, they started unannounced inspections. Before you would know when they were coming, what date they were coming. Now they don't just show up any old day. They usually do give you a time frame, and that's what a lot of your accreditation organizations are going to now. They're not giving you a specific date, but they'll give you an open policy or an open door policy or or a timeline that it will be between this day or within this month or time period. So they're wanting to do that so they can get a better grasp of how organizations are actually functioning without, being too much of a surprise, but getting a better idea of what it really is like, as opposed to when someone knows exactly the day they're coming for an inspection. In 2021, they started giving accreditations to assisted living centers. I wish more people would do that. Or assisted living centers, I think it would be beneficial for the organization, and I think that patients would probably um, benefit from it as well if some type of organization like the Joint Commission could come in and inspect their facilities. Um, the last one here, which was actually the last one that the Joint Commission talks about that they established, was the Leading Laboratories Recognition Program. And they joined with the American Society of Clinical Pathology to recognize those laboratories that have excelled in inspections, whether it be CAP or any of the other inspections that the laboratories do. And they just started this here in 2000, or excuse me, last year. So they're constantly evolving this organization, and it's, along with the other accreditations, I just think accountability is important. That's what I mean. We're dealing with some very serious people's lives, uh, and I think people have to be held accountable. And so often they're not. It's just, you can't, it's not just a mistake. People have to be held accountable, because when patients come to our facilities or organizations, they're vulnerable and they're depending on us to provide them care. And a lot of times they don't know the questions they need to ask. And we're there for them. We're supposed to be there for them, and they're very vulnerable. And, so they're expecting us to give them the best care possible. Okay, where are we today? Well, the Affordable Care Act was enacted in 2010, and it is 2022. And healthcare reform is still a high debatable topic, and most especially during election periods. This is at the top of the list, and it just feels like sometimes we're spinning our wheels. Everybody has their ideas, and no one likes any other ideas. And it could be because of one political party or the other. Well, can't like that idea because that person is not from my political party. Um, but when President Biden came into office, he rolled back many of President Trump's of reforms. Was it because they were bad, or was it because, you know, uh, there's reasons why he did this, because President Biden and his administration seemed to be pushing more to government run coverage, and they were putting their focus back once again on the Affordable Care Act and how provisions and how things could be reformed to this act, just instead of starting completely over. Now, with any new piece of legislation, things are not going to go as planned, and the Affordable Care Act hasn't exactly gone. It's not everything hasn't gone the way everybody would have liked it to go, but I think President Biden has felt that it isn't enough time has not been spent on it, so he is putting his focus back on that, as opposed to leaving it to the states. There was also the Build Back Plan, and this basically In this plan, it also consolidates federal control over health care as well. Now, states still have a lot of rights, and they have lots of states have enacted their own healthcare reform and to their own policies. And this is just something that's been happening a lot lately, due to different types of issues, even to abortion issues. The states have taken things into their own hands and decided to make reform to their own health care plans that they have for their states. Okay, so for the conclusion, first of all, there are so many things, like I said before, so many important or significant events that's happened between the 1900s and now, uh, in regards to healthcare reform. It just seems to be, um, I guess I could say, a work in progress, but I'm not sure if if what we're working on is what we should be working on or not. But everything that has happened up until this point, small or big, has made has made, good or bad, the U.S. healthcare system it is today. And as it says here on this slide, it is complicated, but there are benefits to it because we have some of the best healthcare in the world here in the United States. And of course, it's expensive, but there are ways, um, for reform to be made so that it could benefit the patient and lower the cost overall. And obviously, um, it's been something that's definitely been researched, and it's always, like I said before, a hot topic during elections. So it's not something that is going to go away because people's health is important, and sometimes it can be costly, but it can be for various reasons, and we need to look at those reasons. And if those reasons are something that can be fixed, then those are the areas that we need to look at, for reform. So at the end, most people consider the United States to be the greatest country in the world. So you would think that we would be able to come together and develop a plan that would benefit all the citizens of the United States, because we are supposed to be the United States of America. Okay, it wouldn't be a good presentation without a little big biblical perspective. The verse here I chose was, "But if anyone has a world's goods and sees his brother in need, it closes his heart against him. How does God's love abide in him?" So to me, this says a lot about our responsibility to care for them, most especially as Christians. If we have God's love in our hearts, that's what we should want to do, is to care for others. There's lots of scriptures in the Bible that talks about that, but sometimes things are taken out of context. So to me, I think about death being the common denominator for everyone here on earth. Of course, as Christians, we will have eternal life with God. But while we're here on earth, the majority of people, I know I have personally want to be able to live my life. I have children. I love life. I love because I feel like life is, God has given me life. It was a gift, and I would like to enjoy that. And so death is the common denominator. Yes, money can buy health care, and it can buy the best doctors, but at the end, only doctors know what they know, and in the end, death will come to all of us. And so health care reform should, involve equality and care for everyone, because this is the one thing we all do have in common. So if this is the one thing we all have in common, and they were all on equal ground, then the care we receive for our help should be equal as well. And so it doesn't matter which party we belong to, we should be able to come together on this subject because it's something that we all have in common. Here are a list of my references. I thank you for your time. This has been um, a very a learning experience for me, and I'm learning a lot about healthcare systems. Even being in healthcare, it's very confusing. So, knowledge is power. It just depends on what type of knowledge you have. Have a good evening.